According to the province, it's another day with more than 500 patients with COVID-19 in intensive care in Ontario. Here at Humber River Hospital, the ICU is full. So with all the necessary precautions, we went inside to meet with one of the doctors and his team to witness the stress that they're dealing with in this third wave of the pandemic. This is what's in store for Dr. Jamie Spiegelman as the 11-year ICU doc starts his day at Humber River Hospital.
Yeah, so I'm just reviewing my list. On my side, I have 20 patients. You didn't intubate any of the COVIDs on optoflows yet?
No,
Okay.
just this one.
As he makes his rounds assessing one COVID patient after the next, this third wave of the pandemic is decidedly different from the past year. The tide has shifted, and patients are getting younger and younger.
Patients like him affect me a little more personally because I know him, I've spoke to him.
When you say it affects you personally, what do you mean exactly?
He's a guy that's younger than me. He has a family, he's any normal guy. He could be your next door neighbor, right?
And then this, another need to intubate a patient desperately in need of air.
Is he talking okay when you talk to him?
He is very short of breath.
He's still short of breath, okay.
Yeah.
Yeah, he's very borderline. A lot of fluffy infiltrates here on both sides, so that's what COVID does. So as you can tell, so he's using high oxygen flow right now, and he's obviously not doing so well. If you look at the monitor, his saturation is 89%, and his respiratory rate is 45 at the bottom line. So this is going to be a rough next 10 minutes or 15 minutes, I could tell you that. So one of the respiratory therapists is holding a tube, but the other one is looking in his mouth and putting it into his lungs right now.
Are you at a point where you pretty much know what you need to do?
I think there is like a typical patient that we're seeing. The thing that's not typical is we have no idea how that person's going to respond to the therapy that we give.
And just like that, it's on to the next patient in the packed ICU and the need to keep families informed.
Anything to worry about?
So far, she's heading in the right direction. I mean, she has chronic diseases like kidney disease, but those are all stable at this point, so I'm not that worried about those right now.
Most of the staff working in the ICU have now received their first shot of the COVID-19 vaccine. While it provides some personal relief, they know it will be some time before the workload eases.
What it has done is it's put life in perspective. It makes you realize what's really, really important in life.
With COVID patients here at Humber River and other hospitals regularly being transferred to other locations, news now that Sick Kids is stepping up and opening 8 critical care beds to younger adults with COVID-19 in an effort to support the province if needed.